All right, we're now headed straight to Imo State, where we are joined live from Owerri, the state capital, by the National Orientation Agency State Director, Mr. Vitus Akocha, who is also a member of the COVID-19 task force in the state. Good evening to you. Many thanks for joining us on Galaxy News, Mr. Akocha. Take us through so far what the NOA has been able to do in terms of sensitization and enlightenment on the people concerning COVID-19, because some people still have this belief that it is not real in Nigeria.
We in the National Orientation Agency, Imo State, have been up and doing in our responsibilities. We have been carrying out motorized campaigns in the rural areas. We have also embarked on what I call oral communication, that is using our megaphones to be going from house to house, from community to community, informing them to observe social distance, to wear their face mask, to observe good hygienic practices of washing their hands or using alcohol-based sanitizer. And that if anybody returns in their community, they should report to the task force so that the task force can carry out their surveillance activities. It has not been easy, actually, but we have been doing our best. Our staff in the local government areas and the local government caretaker committee chairmen have been very nice to them. They have provided for them a vehicle with a public address system where they've been going from one community to the other. Now, the stage we are is in border communities. Because of what has been happening in our interstate borders, we have embarked on a campaign in the border communities to inform them that they should close all the rural routes linking Imo State to other states to prevent people from coming in. Because what we are having in Imo State is importation of the coronavirus, because those that have tested positive are those that came into the state. So we have been doing our surveillance duties, we have been doing our sensitization, paying advocacy visits to traditional rulers and influencers in communities.
With a very quick question, there are speculations or report of a family of 4 who tested positive for COVID-19 in Imo State, and people are saying that they ran away and government is deliberately keeping silent about this. Can you tell us more?
I think that's a wrong notion. Government is not deliberately keeping quiet. What actually happened was that this family of 4 came back from Lagos, and when the task force was informed, they quickly sent the surveillance team who collected their samples and asked them to isolate themselves until the results get back to them. So when the results came back from Abakaliki, 4 of them tested negative. By the time the surveillance team went to pick them for isolation and treatment, they had gone back to Lagos. So what the task force members did was to alert the NCDC and the health people in Lagos, who are now following up the case. So government did not deliberately keep quiet. If you can contact the NCDC in Lagos or the Ministry of Health in Lagos, they are aware of this case.
Before we let you go and all of this now, so what would you say the the awareness campaign level in Imo State is? Because I actually had to speak with some people. They say that they've been doing everything they can. They've been living healthy. They've been taking, supplements to keep themselves healthy. Do you really think that they are indeed well sensitized about what they need to do to, stop them from contracting this particular virus?
Yes, I can say that the awareness level is so high that even if you go to the rural areas, when people step out of their communities, they are wearing face masks. They understand what they need to do to ensure that they avoid contracting this disease. So I can say a lot of work has been done in the area of sensitization and information sharing in Imo State.
Many thanks. We have been speaking with Mr. Vitus Akocha. He is the National Orientation Agency State Director and also a member of the COVID-19 task force in the state. Away from him.